Before watching this video, please subscribe and hit the like button. Hello everyone. Would you like to know if your lungs are sending warning signals in just 3 seconds? I believe that my daily habit of checking my fingers in the mirror each morning can save lives. Today, I'd like to share with you hidden warning signs of lung cancer and a simple self-diagnostic method using your fingers. By watching this video to the end, you'll learn how to detect lung cancer early, why screenings are important, even without symptoms, and practical habits to keep your lungs healthy. Lung health becomes more precious as we age. Shall we take the first step together to protect your precious lungs? I'm Dr. Robert Williams, a lung specialist of 85 years. Over the past 50 years, I've treated more than 30,000 patients and witnessed how small signals from the lungs can make a tremendous difference. In my youth, I struggled with pneumonia and realized how grateful we should be for each breath. That experience helped me understand the importance of lung health more deeply than most. My patients, especially those over 60, often ask, "Doctor, isn't shortness of breath normal with aging?" But I tell you, it's absolutely not normal. When we recognize the signals our lungs send, we can live healthier, more vibrant lives. I still vividly remember the story of 62-year-old John Miller, who visited my office. John had never smoked and always prided himself on his health. One day, he watched a YouTube video about finger self-diagnosis and, feeling anxious, came to the hospital. He had noticed his fingertips becoming slightly rounded. Tests revealed early-stage lung cancer. It was shocking news, but fortunately, because it was caught early, a simple surgery cured him. Today, John plays soccer with his grandchildren in the park, laughing and smiling. What he told me remains in my heart, "Doctor, if it weren't for that video, I wouldn't be here today." Lung cancer is the leading cause of cancer death in America. Each year, over 230,000 people are diagnosed, and more than half are discovered too late. But when detected early, survival rates can reach 80%. Lung cancer progresses quietly, like a thief. It may already be growing inside your body even without symptoms. Today, I'd like to show you the warning signals your lungs might be sending, and how you can check for yourself. These methods require no medication or expensive equipment, just 3 seconds looking at your fingers. Through this video, I hope you'll discover the secret to staying healthier and longer with your loved ones. Why is lung cancer so frightening? It's the leading cause of cancer death in America. Over 230,000 people face this terrible disease each year, and 60% are discovered at stage 3 or 4. Even more tragic, 40% are found too late, with survival rates below 10%. Lung cancer sneaks in quietly like a thief, infiltrating our bodies without our knowledge. Let me tell you about 68-year-old Margaret Wilson. Margaret never smoked and always took care of her health, going to the farmer's market each morning for fresh vegetables and spending time with her grandchildren brought her joy. Then one day, a mild cough persisted for several weeks, and she gradually became short of breath. Thinking it was just age, she ignored it, but at her daughter's insistence, she visited the hospital. Tests revealed early-stage lung cancer. Thankfully, with early detection and treatment, she now takes morning walks in the neighborhood park and creates more memories with her grandchildren. Margaret told me, "Doctor, if I hadn't gone to the hospital, then I would have left without seeing my grandchildren's graduation." Hearing those words, I was reminded again of the power of early detection. Why is lung cancer so dangerous? Because it progresses very subtly. According to Mayo Clinic research, the 5-year survival rate for lung cancer is 80% at stage 1, but drops to just 5% at stage 4. What these numbers tell us is simple: the detection timing determines survival. So what are the warning signs of lung cancer? First, let's talk about coughing. Have you experienced a cough lasting more than 2 weeks despite not having a cold? This might not be a simple throat cold but an SOS signal from your lungs. 75% of lung cancer patients experience this cough. For 50 years as a lung specialist, I've seen countless patients regret ignoring this small signal. But fortunately, if you recognize this signal and act quickly, you can catch lung cancer early. I'm reminded of 70-year-old Samuel Thompson who visited my office. Samuel had been a farmer all his life and lived healthily. He would wake up early every morning to tend to his fields, and spending time with his grandchildren was his joy in life. Then one day, he developed a cough. At first, he thought it was a mild cold, and bought cold medicine from the pharmacy, but the cough continued for over a month, often with sticky phlegm in the mornings. Thinking it's just part of aging, he dismissed it, but at his son's persistent urging, he finally visited the hospital. Tests revealed early-stage lung cancer. Why is coughing a warning sign for lung cancer? A cough is the first message your body sends to alert you to problems in your lungs. When lung cancer begins, the tumor irritates the airways, or causes inflammation, triggering coughing, especially if you have a severe cough with sticky phlegm in the morning, or if the cough continues for more than 2 weeks. It's likely not a simple cold. According to American Cancer Society research, 75% of lung cancer patients experienced persistent coughing before diagnosis. Even more surprising, 30% of patients who dismissed this cough as a cold or age-related were later diagnosed at stage 3 or 4. Your cough is your lungs crying, "Help me." Ignoring this cry allows lung cancer to grow quietly and become more dangerous. So what kinds of coughs should you watch for? Remember a few things first. Never ignore a cough that persists for more than 2 weeks. Second, be especially careful if you have morning coughs with phlegm. Third, if your cough produces bloody phlegm, see a doctor immediately. Another warning sign is shortness of breath and chest pain. Have you ever felt short of breath or tightness in your chest without exercising? Or experienced sharp chest pain? These could be other warning signs of lung cancer. 50% of lung cancer patients experience abnormal breathing patterns, and 30% feel chest pain. I recall 65-year-old Janet Brown who visited my office. Janet was the most energetic person in her neighborhood. She sang in the local choir every morning, and enjoyed going to the market with her grandchildren. But one day, she started getting short of breath whenever she climbed stairs. Thinking this is normal with age, she dismissed it, but when she occasionally felt dull chest pain, she became anxious. With her family's encouragement, she visited the hospital, and a chest CT scan revealed a small tumor. It was early-stage lung cancer. Why are shortness of breath and chest pain signals of lung cancer? As lung cancer progresses, tumors can block airways or interfere with oxygen supply to the lungs, causing breathing difficulties. If you feel short of breath while walking or climbing stairs as usual, it's a warning that your lungs aren't supplying oxygen properly. Chest pain occurs when cancer cells irritate the chest wall or surrounding tissues. Did you know lung cancer can progress silently, even without symptoms? This is called silent progression. The lungs have very few pain-sensing nerves, so even as cancer grows, your body might not detect it. I remember 72-year-old Michael Davis who visited my office. Michael had worked as a teacher his whole life and paid special attention to his health, taking morning walks in the neighborhood park and riding bicycles with his grandchildren brought him joy. He had no coughing or shortness of breath and always considered himself healthy. But one day, at a colleague's suggestion, he got a health checkup. A small mass was discovered on his chest. X-ray and further tests confirmed early-stage lung cancer. Michael was shocked. "How could this happen when I had no symptoms at all?" he asked, looking incredulous. Thankfully, with early detection, simple treatment cured him, and now he enjoys an even more active life cycling with his grandchildren. Why does lung cancer progress without symptoms? Unlike other organs in our body, the lungs have almost no pain-sensing nerves, so even if cancer grows or pneumonia develops, you might feel nothing in the early stages. Lung cancer often begins as chronic pneumonia, or cellular changes that gradually develop into tumors. This process proceeds invisibly, like a quiet river eroding rock. According to the American Cancer Society, 40% of asymptomatic lung cancer patients are discovered through routine health screenings. More surprisingly, over half of these patients, with no symptoms, were already at stage 2 or beyond. Remember, having no symptoms doesn't mean you're safe from lung cancer. In fact, you should be more cautious when there are no symptoms. The simplest and most effective method is an annual chest X-ray. This test takes just 10 minutes, and is covered by most insurance plans, making it affordable. If you have a smoking history, live in an area with severe air pollution, or have a family history of lung cancer, consider adding a chest CT scan. Now, let me tell you about an amazing method to check for lung cancer at home. The finger self-diagnosis test. Place your index fingers together. Do you see a diamond-shaped gap between your nails? This simple 3-second test can tell you about your lung health. For 50 years as a lung specialist, I've seen countless times how small signals like finger shape can save lives. Clubbing is an important warning sign of lung cancer or chronic lung disease. Today, I'll explain this remarkable self-diagnostic method you can do at home and what it means. I'm reminded of 60-year-old Patrick Johnson who visited my office. Patrick enjoyed playing with his grandchildren his whole life and took care of his health. Every morning, he would push his grandchildren on swings in the neighborhood park, and on weekends, he enjoyed going to the market with his family. One day, he noticed his fingertips had become slightly rounded. At first, he thought his nails were growing oddly and dismissed it, but at his wife's encouragement, he visited the hospital. Tests revealed early-stage lung cancer. What exactly is clubbing? Clubbing is a condition where fingertips become rounded and club-like due to oxygen deficiency, caused by lung cancer or chronic lung disease. When you place your index fingers together, if you don't see a diamond-shaped gap between the nails, you might have clubbing. This phenomenon occurs when chronic hypoxemia causes the blood vessels under the nails to enlarge. According to the American Cancer Institute, 35% of people with clubbing have lung-related conditions, such as lung cancer, chronic bronchitis, or pulmonary disease. More surprisingly, clubbing can occur before symptoms like coughing or breathing difficulties appear. How do you perform this self-diagnosis? It's very simple. First, place your index fingers together with the nails facing each other. Check if there's a small diamond-shaped gap between the nails. Healthy fingers should have this gap. If there's no gap, or if your fingertips appear rounded and swollen, you might have clubbing. This test takes just 3 seconds in front of a mirror in the morning. Finally, let's discuss simple habits to lower your risk of lung cancer. Did you know that lung cancer can be prevented with small daily habits? The first habit is quitting smoking. Smoking is identified as the cause of 80% of lung cancers. If you smoke now, decide to quit today. The second habit is avoiding dust and pollution. Fine dust and occupational dust are major factors that damage the lungs. 70-year-old Henry Anderson worked in a factory for 40 years, exposed to dust. After retirement, he would still get short of breath, but he started wearing masks daily and ventilating his home frequently. He also added antioxidant foods to his diet, especially eating half a tomato every day to improve lung function. The third habit is eating antioxidant foods. Broccoli, tomatoes, and mackerel are treasures for lung health. Antioxidant foods reduce free radicals that damage lung cells. According to the American Cancer Institute, consistently consuming antioxidant foods can lower lung cancer risk by 30%. Many of my patients added a small piece of broccoli in the morning, a piece of mackerel at lunch, and half a tomato in the evening. They reported improved lung function and easier breathing with these small changes. It's not complicated. Put a slice of tomato and a few pieces of broccoli on your dinner table tonight. These foods act like shields for your lungs. To summarize what we've learned today: first, don't miss the warning signs of lung cancer. A cough that persists for more than 2 weeks, breathing difficulties more severe than usual, and dull chest pain are SOS signals from your lungs. If you have these symptoms, don't hesitate to get a chest X-ray or CT scan. Second, don't be complacent even without symptoms. Lung cancer is famous for its silent progression. An annual chest X-ray is the most reliable way to catch lung cancer early. Third, remember the finger self-diagnosis method. If there's no diamond-shaped gap when you place your index fingers together, visit a hospital for accurate testing. Fourth, practice the 3 habits to protect your lungs: quit smoking, avoid dust, and eat antioxidant foods. These small habits will reduce your risk of lung cancer and make your lungs stronger. I've seen countless patients over the years and confirmed that these small changes save lives and enrich quality of life. Like Janet, Michael, and Margaret, you too can protect your lungs and enjoy more precious moments. Lung health isn't just a health issue, it's about preserving happy moments of playing with grandchildren, planning family trips, and breathing fresh air deeply each morning. If this video has been helpful, please subscribe and hit the like button. Share this valuable information with your family, friends, and neighbors. Your small action can protect someone's lung health and bring hope to many. I wish you a healthy future and more happy times with your loved ones. I'll be back with more valuable health tips in my next video. Until then, stay healthy and smile every day. If you enjoyed watching this video, please subscribe and hit the like button.